Hello everyone, welcome back to our channel. I am Dr. Swati Mehta and today we will be discussing an important obstetric topic, that is fetal malpresentation and malposition. This presentation will help you to understand the types, causes, risks, diagnosis and management of the abnormal fetal position during the pregnancy and labor. Fetal malpresentation refers to any presenting part of the fetus other than the normal vertex or head down position. Common type includes breech, transverse, lie, face, brow, and sinciput presentation. This may be detected late in the pregnancy or sometimes only during the labor assessment. Several factors increases the risk of malpresentation. This includes multiple pregnancies, excess or decreased amniotic fluid, uterine abnormalities such as fibroids, placenta previa, preterm birth, and multiparity. Identifying these risk factors early help in proper monitoring and management. Malpresentations are characterized mainly into three groups: vertex varieties such as brow, face, and sinciput, breech presentation, and the transverse lie. Diagnosis is usually made through the sonography and vaginal examination. Abnormal vertex presentation shows sinciput, face, and brow presentation. Face presentation occurs when the fetal head is fully extended. If the chin is anterior and vaginal delivery may be possible. If the chin is posterior, caesarean section is usually required. Sinciput presentation involves the partial extension showing the labor in progress. Brow presentation occurs due to the partial extension of the fetal head, and this presentation usually cannot deliver vaginally and it required caesarean section. There are four main type of breech presentation. Frank breech, where the hip is flexed, knees extended, and this is the most common type of breech presentation. Complete breech means baby is sitting with the cross-legged. Footling breech, one or both the feet present first, and kneeling breech, very rare, where the baby appears kneeling. Each type affects the delivery planning and the difficulty. So breech presentation increases the risk for both mother and baby, and maternal risk includes prolongation of the labor, infection, hemorrhage, and birth canal trauma. Fetal risk includes cord presentation, head entrapment, birth trauma, and the asphyxia. In the transverse lie, a fetus lies horizontally, and here the presenting part is either shoulder or a hand or an elbow or the umbilical cord. The occipitoposterior position, baby's head faces the mother's abdomen instead of her back. The same thing when occipitotransverse, baby's head is situated transversely. So this can cause intense back pain. There is prolongation of the labor and increase the risk of the operative delivery. If the breech presentation or transverse presentation detected before the labor and the membranes are intact, then external cephalic version may be attempted before 37 weeks. In external cephalic version is successful, normal vaginal delivery may proceed. If unsuccessful or contraindicated, then caesarean section is recommended. Vaginal breech delivery may be considered if the breech is complete or frank, the pelvis is adequate, the baby is not too large, and the head is flexed. However, caesarean section is safer in cases such as double footling breech, large fetus, small pelvis, or previous caesarean section. Caesarean section is required when there is double footling breech, small or malformation of the pelvis, very large fetus, there is previous caesarean section for cephalopelvic disproportion, hyperextended or deflexed head, short cord, cephalopelvic disproportion, and placenta previa central or incomplete. These are the indications of the essential caesarean section. Nursing care plays a crucial role. Encourage the sideline away from the fetal back, pelvic rocking, and the knee chest position to promote the rotation. Apply the sacral counter pressure to relieve the back pain and provide the continuous emotional support. Anxiety is common for both the mother and the family, so we should offer clear teaching about the condition and its management to reduce the fear. It is important to listen to the patient, provide emotional support, and encourage her to express her feelings. Breathing exercise can also help relieve the anxiety during labor. Assess the degree of anxiety and remain with the patient or arrange the support if needed. Always allow the patient and the family to ask questions and explain all procedures in a clear and understandable way. This supportive care helps improve the mother confidence and the overall childbirth experience. In managing the fetal malpresentation or complication of the labor, careful monitoring is important. We should observe closely for any abnormal labor patterns and continuously monitor the fetal heartbeat and the uterine contractions. The team must always be prepared for childbirth emergencies, such as cesarean section or forceps assisted delivery. Maintaining sterile equipments and proper preparation helps ensure the safe and effective care. To prevent infection, strict hygiene measures must be followed. We should practice proper hand washing and maintain the sterile techniques during the procedures. The incision site should be cleaned daily as needed, and dressing should be changed when necessary. Homeopathy plays a supportive role in managing such conditions by promoting the natural correction of the fetal position and improving the uterine function. Among the homeopathic remedies, Pulsatilla is one of the most widely used medicines for the malpresentation. Pulsatilla is prepared from the windflower plant, and it is commonly used in homeopathy during pregnancy, especially for the cases of malpresentation of the fetus. Pulsatilla is especially indicated when the baby lies in breech or transverse position during the later months of pregnancy. It helps to stimulate the gentle uterine activity and may encourage the baby to turn into the normal head down position. Homeopathic philosophy suggests that pulsatilla may help to uterine relaxation and encourage the baby to turn to the cephalic position naturally. Let me clarify here. In Hahnemann's Materia Medica Pura, it is not indicated like breech presentation, but he noted that it works on the female reproductive system, uterine muscles, hormonal regulations, circulatory and venous congestion, and mainly the changeable symptoms. Thus, according to the principles described in Materia Medica Pura, Pulsatilla acts as a gentle yet powerful remedy in pregnancy-related conditions, especially when malpresentation is associated with weak uterine action, the characteristic Pulsatilla constitution. Then, the Pulsatilla indicates the tendency to correct the irregular or abnormal position due to uterine inertia. By improving the tone and coordination of the uterine muscles, it may help and facilitate the natural adjustment of the fetus. So changeability is important here because changeability is related with the malpresentation too. According to the homeopathic philosophy, when the mother's totality match to pulsatilla, especially emotional softness and tearfulness, then the remedy stimulates the vital force. So when the fetus lies in an abnormal position, pulsatilla is considered when the uterine activity is weak, irregular, or inefficient, and it helps to regulate the uterine contractions and support the natural tendency of the fetus to assume the correct head down position. So, Materia Medica Pura shows Pulsatilla acts on the uterine sphere, it corrects the irregular contractions, it relieves the venous congestion, it harmonizes the emotional state, it restores the balance in the vital force, and when balance returns, the natural alignment may occur, and this is the classical reasoning behind the use of this remedy for the breech presentation or transverse presentation. In my clinical practice, I usually consider pulsatilla in cases of malpresentation during the later stage of pregnancy, where I generally start observing the fetal position around 30th to 34 weeks of the gestation. If the fetus is not in the normal cephalic position, I begin treatment with pulsatilla, provided there are no obstructive complications or emergency conditions. I first prescribe pulsatilla 200 and continuing till the completion of the 8th month of the pregnancy. After the 8th month, I shift to the Pulsatilla 200 twice a day, and depending on the response and clinical assessment, I can find out that the position is already changed, then continue with the same uh, potency and the dose. It correct the head down position before the labor, and important is there is no mechanical obstruction, obstetric complications or emergency conditions. I observe in my practice that pulsatilla increase the fetal movement, and because of that there is spontaneous version to the cephalic. It also improves the irregular contractions, so it gives muscle tone to the uterus. Many of the cases I have treated with the help of pulsatilla in case of malpresentation and malposition. In summary, the fetal malpresentation and malposition are the significant obstetric conditions requiring early diagnosis and proper management. Careful assessment and skilled clinical judgment and timely intervention with the pulsatilla help ensure the safe outcomes for both mother and the baby. Thank you for watching my video, and if you found it helpful, please like and share and subscribe for more educational content.